Great. Thank you so much, Dr. Zhao, for those remarks. So next, I'm going to ask that Charlie Alexander come up and walk us through the Poll Everywhere, which is going to be our platform to engage folks. But first, I want to introduce Charlie, who graduated from the University of Chicago in 2010 with a Bachelor's of Arts degree in political science. She's currently doing her Master's in Public Health at Johns Hopkins University. And prior to joining the academies, Charlie was a legal assistant at the civil rights firm Samford Heisler, LLP, where the majority of her cases involved race and gender discrimination in the workplace. So, Charlie?
Good morning, everyone. So as Kimber mentioned, we really envision this meeting as being participatory. So I'm going to count on all of you in the room and those 250 and 300 of you on the webcast to really submit your responses to the questions that I'll show shortly. So Poll Everywhere is a real-time audience engagement tool. And before I take us to the questions, I just want to give you a bit of background. So responses will automatically populate on the screen via submissions via your mobile phone or laptop. Okay, so everyone pull out their phones or your laptops. And if you could put in the to line the number 22333, that'll get us started. Or if you're using your computer, go to www.pollev.com/NAMCOHP. And that's POLLEV.com/NAMCOHP. Okay. Raise your hand if you're having any questions or trouble or have any questions. Okay, so if you're using your mobile phone to initiate your responses, text NAMCOHP, and that should get us started. Case shouldn't matter. I don't think it's case sensitive. Okay, so our first question is, what is the most important health equity issue to you or your organization? So we've got some responses coming in. So far we have health literacy, health consequences of self-efficacy, structural biases, systematizing it, ranging from knowledge to funds, veteran mental health care, oral health equity, access to family planning, women's health, getting the community started, K-12 education, structural and implicit bias, access to resources, the Affordable Care Act, the impact of health on educational outcomes, quality care at all levels, pediatric food insecurity, LGBTQ access, racism and all of its levels, breast cancer health disparities, minority representation in the healthcare workforce, access to literacy education, access to healthcare, political and economic power, early childhood care and education, health education, systems coordination for access to benefits, displacement and gentrification, connecting and leveraging existing resources, culturally appropriate health education programming, healthy food access, Hispanic health, funding opportunities. I could go on and on. So I hope that this mechanism allows you to see where everyone's coming from, both in the room and on webcasts, and it seems like there's a lot of shared interests, and there are a lot of important health equity issues to tackle, and some of them we'll address today. So we'll have 2 more of these sessions throughout the meeting today, and we'll also accept questions via poll everywhere for one of our first panel discussions. So thank you all very much for submitting your responses, and I hope you'll connect over some of these issues both in session today and during the breaks.